We've talked already about building relationships with the community, and you're our real focal point in Cape Town, building those relationships. And one of the things that we really try to do as an organization is to benefit the community in some way with our programs. And I just wanted you to be able to talk about, from your perspective, how you see that happening.
I think, for our communities especially, we are being faced with many challenges in terms of low socioeconomic standards and various other things. But for our communities especially, getting students in from abroad, they learn from them, and they want to share their culture, they want to share their experiences. So it's a learning curve for both students coming in as well as our communities. And because of the challenges that we are faced with, especially limited resources, and one of those challenges, it's access to financial aid, and that is where CFHI fits in so nicely, because their motto is, giving or donating or giving micro donations to communities, especially underserved communities. And I can give you two examples where CFHI really played a major role in assisting communities. We have this one project in an area called Manenberg on the Cape Flats. We CFHI donated X amount of monies, and I asked them, the project manager at Self-Help Manenberg, to write a proposal for us, which I was very impressed with. And they wrote a proposal on, the screening process from kids newborn up to the age of 6 years. And it's a wonderful project, because what they actually do is they get the medical students that have served the community and comes in during their off time, and they actually do the screening.
And these are medical students, South African medical students.
South African medical students.
Not the CFHI students are coming,
students,
but we're actually utilizing the South African medical students from the University of Cape Town.
So we've had quite a number of referrals, patients that actually needed intervention that was referred to tertiary institutions like the Red Cross Children's Hospital, for instance. And that's a wonderful initiative. The other project that we're involved with is the Stellenbosch University, the Avian Park Ukwanda project. It's a rural project. So they're involved with this tuberculosis project in Ukwanda, which is just outside of, in Avian Park, which is just outside of an area called Worcester. And CFHI also donated, made a donation, and in turn what they then did was they purchased a piece of land, and that in itself was a process for the university. And what they did, they sort of bought containers, and Steve had the opportunity of going through.
So these are containers that would be sent on a ship all filled with cargo, but instead of using them for cargo, they're able to be converted and used as a small clinic.
That's right. So they have these
like 2 or 3 rooms,
consultation rooms in there, and students can go in with a doctor, and they actually assess the patients. But it's a wonderful project, and Ukwanda was really appreciative of this donation made by CFHI. And it's a project whereby the community, because they're actually taking healthcare right to the community by doing this.
Fantastic. How about the other medical doctors that work in the community that our students work with and that you oversee? How do they benefit from these relationships?
It's always wonderful to interact with our local South African students, and exactly the question that you're asking now, for them it's a learning curve, because the way the program is run, or in the US, where they do 4 years of medical school after their undergraduate degree, as opposed to South Africa, where we go straight from grade 12 and you start your 6 years at the medical school. So for them it's quite a learning opportunity, because they can now sort of compare the differences in terms of healthcare and the education system itself.